And so what we're really looking for when we're talking about correct, normal, day in, day out physiologic breath is the relationship between the diaphragms or the transverse planes of the body. So in this picture, we're just looking at the two lower transverse planes, which are the respiratory diaphragm and the pelvic diaphragm. And you can see that really what we're wanting is to have those planes be parallel. When those planes are parallel, and the core is engaged, the transversus abdominis is engaged, then what happens is that you have a container. And so we call that the abdominal wall. The abdominal wall is like the chest, right? The chest wall. These are two walls. And so in dynamic neuromuscular stabilization, we call this container breathing so that the belly shouldn't be pooching out with the breath and that the diaphragm should be going up and down, and that we should have this hydrostatic pressure and a pressure gradient system in the body because we are a container breathing with the diaphragms parallel to each other. So there are many patterns, many postural patterns that we see where the diaphragms are not parallel to each other. And this causes musculoskeletal pain and problems and also abnormal breathing patterns. So if you're hyperlordotic, if your lumbar curve is too big, then you'll come into what's called an open scissor um, um, rib cage or manifestation of the transverse planes. You'll have an anteriorly rotated pelvis, and then the chest will be rotated up. And so then you're not going to be able to create that container, so you will not have proper breathing patterns. And one of the reasons that this container breathing is so important, and it's so important to have the parallel diaphragms, is that when we breathe, it's not just about oxygen and CO2. What it's also about is creating a system where the deep lymphatic system is moved throughout the body. The breath is what moves the deep lymphatics. Exercise moves the superficial lymphatics. And so we really need to have the 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 diaphragms, the container set up for correct breathing so the deep lymphatics can move properly. And if you see this third diaphragm, then you'll see really a flattening of the curvatures of the spine. And so with that too, you have an open scissor to a lesser degree, but definitely you're not creating that viscoelastic hydrostatic system in the body where you're having a container that's moving and you're breathing into it. This you'll see will give you more of the maybe thoracic pain rather than lumbar pain. And then in the fourth one, this is, typically what we would see for the tech neck. So you'll see the anterior head carriage, hyperkyphosis, hyperlordosis, and then the springing up of the rib cage and the anterior pelvic tilt. And so you're not creating a container at all. You're not getting proper function in the diaphragms. You're getting pain, and you're not getting correct lymphatic movement or correct breathing patterns.